So, hi everybody, this is Dr. Rosie Chen here, and I wanted to be able to help people who are about to take any type of exams about acupuncture that pertains to the back, as in the back itself, to be able to have more of a way to get their mind clear about how to confirm that to know where the point location is of the bladder channels, to do my channel at some point. So what I'm here to do is a process that I would like you guys to do on your own, so you can create the information, and then when you have it ready next to you, like let's say it takes a few minutes to do, all the questions are going to be on the back are going to be something you can immediately confirm through your drawing. So that's the intention. So I'm going to just walk you through it. I'm going to make it a bit more detailed. I'm going to try to use some colors that would help bring some more clarity, I hope. So we're going to just draw the thoracic spine and then the lumbar spine with the sacrum and the coccyx here. And then we're going to talk about the bladder line, inner bladder line, and then the lateral bladder line, the relationship with the segment on the spine. And then we'll take a small stop and we'll do it also with the do-my, so you guys have both as well, okay? So I'm going to try and stick to the proportions. That's the hardest thing here. So let's say that we're going to do C7 right here, okay? Just starting there. And then we know there's 12 thoracic vertebrae. So let's say we want to finish here. That's going to be about 6, about 3, about T9, right? Well, a little bit more like so. And then let's see. So we have, that's going to be T1. Let's do T2, T3. And the spinous process is right through there. And then let's do T4, T5, T6. It's not perfect, but it helps bring the message. And then we have T7, T8, T9, and then we have T10, T11, and T12. All right, so these are our thoracic spine, except our spine is process for C7. I hope it's not too much information here. So the lumbar spine is going to be comprised of 5 lumbar vertebrae. So we have L1, and they're a little bit larger. L2, L3, L4, and L5. And again, they also have their spinous process right there. And then we also have the sacrum. The sacrum, right under the spinous process of L5, we have 4 foramens. Those are the here. Here we go. That little area is known as the hiatus of the sacrum. It's where D2 is located. And then it's also the junction between the sacrum and the coccyx. So the coccyx is a little remaining of the tail we used to have. Okay, so let's make that to be our sacrum here, roughly. Okay. Now, I hope it's legible. The neck is obviously right here. The shoulder blade is going to be here. I think it's important that we put it in context. So let's say that this is about 1.5 and this is about 3 out, right there. So the medial border of the scapula, which is approximately about here. That's our right scapula. We can argue that the ilium goes around here, right? And then there's the trochanter that goes here. The gluteal crease is going to be somewhere around there, okay? So, and then we have the contour of the body right around here. Perfect. So far, I hope so good. Let's use another color to try and bring to life the urinary bladder channel. Okay? So C7, 3 out, is actually, because this is 3, let's put 3 inch for that, is actually reserved to small intestine 14. Okay, so I'll put a little bit of a note. This is small intestine 14. Now, T1 is where we're going to start the actual UB bladder. The inner bladder line, let's start with the inner bladder line, is exactly half the distance, so that's going to mean 1.5. Let's put 1.5 here, right there. And this is going to be bladder 11. So let's just put, because it's already blue, the number 11 here for bladder 11. And then it's pretty much consistent when you go all the way down 1.5 out. However, I do want you to recognize the importance of T8 as a unique level. And here's why. We're going to find 12 here, level with T2, which is great, by the way, because it's easy to remember. And then 13 levels with the bottom of T3, and 14 level with the bottom of T4. And then we're going to get there until we hit 17. Okay? 17, again, I'm trying to put it in the level of the base of the spinous process. T8 is unique in that there's no bladder lines under that area. So there's nothing here and there's nothing here, both levels. Not only that, there's nothing here also as far as the Dumai. So if we can recognize that, it's going to help us better understand where the other points in relation. Okay? So continuing on with T9, bladder 18 is going to be right here, 1.5 out. That's the backshoe point of the lever. Okay? And then we continue with T9, T10 is going to be gallbladder backshoe, right, bladder 19. And then we have 20, the backshoe of the spleen. And the bottom of the thoracic is bladder 21. It's also the place maybe to consider showing the floating rib, right? It's touching in that direction. And that's the rib cage here. Okay? I hope it's not confusing people, just the ribs. Now, with the inner bladder line, which I sort of like started to veer off to the side, it should be all within that line. We pretty much stay consistent all the way to the bottom. So L1, this is where we are aligning with the lumbar spine, is going to be with the Sanjiao bladder, or I would say backshoe. L2 is the 23, this is the kidney. And then we have 24, 25, and 26 right there. Wow. My 1.5 line is a little off, but you guys with me, right? What's interesting about the rest is that they are staying consistent with the level of the foramens. So 27, 28, 29, and 30 are right there with their level. This is where the bladder line or inner bladder line actually jumps to here, being 31, the Baliao, the 8 liaos are right there within the foramens. 33 and 34. This is the little angle because the sacrum is wider on top and then gets narrower, so it goes a little bit in an angle. And then the tip of the coccyx, which is around here, 0.5, we're going to find 35. This is the last point on the back side of the back, as far as the bladder line, with the exception of that little curve here, which should be 1.5. Let's put a small pause here.